After knee replacement surgery, there are going to be moments that catch you completely off guard. Not the big things, but the small ones. Putting on your shoes, picking something up off the floor, walking to the kitchen, and realizing you're not even sure if your walker is right. These are the moments you might not be prepared for, and that's where having the right equipment can make all the difference. In this video, I'm going through the equipment that actually matters for your recovery, not as a random shopping list, but by walking you through what a typical day looks like right after surgery, so you'll know exactly what you'll need and when you'll need it. I'm Dr. George Benajam, and I'm a Harvard-trained, board-certified orthopedic surgeon who specializes in hip and knee replacements. I've helped thousands of patients prepare for surgery, and the ones who have the right equipment ready at home consistently have a smoother, more confident recovery. So let's walk through your day, starting at the moment you wake up. Your first challenge is just getting out of bed. After surgery, lifting your operative leg can be surprisingly difficult. Your hip flexors, the muscle that lifts your thigh, have to work against a leg that's swollen, stiff, and painful. And your quadriceps, which works to keep your knees straight against gravity, are often weak because of the knee's inflammation and swelling. This can make something as simple as swinging your legs out of bed feel like a real struggle. That is where a leg lifter strap comes in. It's a simple fabric strap with a loop that goes around your foot. You use your arms to help guide your leg in and out of bed, taking the strain off of your hip and thigh muscles. It's especially helpful in those first 1 to 2 weeks after surgery where the pain and swelling are at their peak. If you have someone helping you at home, you may not need one. But if you're recovering on your own, or you just want to feel more independent getting in and out of bed, it's a small investment that can make a real difference. And if you don't want to buy one, you can even use an old belt, especially if you punch a hole near the buckle to create a small loop for your foot. It won't have the same padded handle that the leg lifter straps have, but it still gets the job done. All right, so you're sitting at the edge of your bed. Now, before you take a single step, let's talk about what goes on your feet, because this is much more important than many patients realize. Here's what might surprise you. Research in older adults has found that walking barefoot or in socks around the house was linked to a significantly higher risk of falls compared to walking in shoes. And after knee replacement, your balance is already off and your leg is weaker, making stable footing even more important. Slippers and sandals are comfortable, but they're also easier to trip in. For most people, the safest shoes after knee replacement are supportive, closed-heel, non-slip shoes that you can wear inside the house. Basically, a stable shoe that has a back on it and a sole that grips the floor. But here's the thing, getting those shoes on when you can't even reach your feet is a challenge all on its own. That is exactly where two tools come in. A sock aid is a small plastic device that holds your sock open. You drop it to the floor, slide your foot in, and pull the attached cords to slide the sock on. It takes a little practice, but once you get the hang of it, you can put your socks on without bending down at all. And a long-handled shoe horn lets you slip your foot into your shoe without having to reach. Combined with a shoe that has an easy closure, you can be fully on your feet without anybody's help. And speaking of shoes with an easy closure, hands-free slip-on shoes have become extremely popular with knee replacement patients because you don't need to bend down or use your hands to put them on. You just push your foot in. If you're open to buying a new pair of shoes, these are probably among the best options out there. Now you're ready to start moving with your walker. Walkers seem simple enough, but there are actually important details that can turn them from a help into a danger. Most patients will start with a front-wheeled walker, which has 2 wheels on the front legs and 2 fixed rubber tips on the back. This design lets you push the walker forward without lifting it, while the back legs provide stability and keep it from rolling away when you're not moving. Here's a key distinction. A rollator is not the same as a front-wheeled walker. A rollator is a walker with 4 wheels and a built-in seat, and they can actually be risky in the early weeks. Because all 4 wheels roll freely when the brakes aren't engaged, a rollator can slide away from you during transfers, like when you're standing up from a chair or a toilet. Studies on falls have actually found a higher risk of falling backward when using a rollator, often because the walker rolled away when the brakes weren't set. So early on, a front-wheeled walker is often safer. A quick note on fit. When you're standing upright with your arms relaxed, the handles of your walkers should sit right around wrist height. If they're too low, you'll hunch over. Too high, and you won't be able to push off comfortably. Your physical therapist can help fine-tune the height. And a couple more practical tips. Attaching a small basket or a pouch to your walker can be a huge help. Right after surgery, trying to carry things with your hands while walking with a walker increases your fall risk. A walker pouch lets you keep essentials like your phone, medications, and a water bottle all within reach. And if you have stairs in your home that you need to climb frequently, consider having a walker on each level. Trying to carry a walker up and down stairs is not something you want to be doing right after a knee replacement. A cane is also a very helpful and commonly used piece of equipment. Your physical therapist can help guide you on when to switch between a walker and a cane. And that timing is different for everyone. It depends on your strength, your balance, and how your gait is progressing. But for many people, that switch happens about 2 to 4 weeks after surgery. When you do make the switch, it's often best to hold the cane in the hand opposite your surgical leg. This helps you shift your weight away from your surgical leg and gives you better balance. And just like with the walker, the handle should sit right about at wrist height when you're standing upright. Now, one of the first places you'll probably want to walk to in the morning is the bathroom. And thanks to slick surfaces and difficult transfers, your bathroom happens to be one of the most dangerous rooms in your house early in the recovery. Let's start with the toilet. Standard toilets sit fairly low, and that's a problem after knee replacement. The lower the seat, the more your knee has to bend, and the harder your muscles have to work to stand back up. Raised toilet seats and over-toilet commodes solve this by raising the seat height. Commodes and some raised toilet seats also have armrests to push off of, giving you more support when you need it most. Now, for the shower itself, what you need depends on your bathroom setup. If you have a walk-in shower, a shower chair lets you sit while you bathe, which takes the balance struggle completely out of the picture. If you have a tub, stepping over the edge of the tub is one of the most common early fall risks. A tub transfer bench avoids this altogether. It sits partially inside and partially outside the tub, so you can sit on the bench, swing your legs over, and slide in without having to balance while stepping over the edge. And here are 2 more pieces of bathroom equipment that can make your life easier. A long-handled sponge helps you wash areas that are hard to reach, especially when your knee doesn't bend easily. And if you don't already have a handheld shower head, it may be worth adding one. This lets you rinse off without having to do as much reaching or twisting. Now, I cover bathroom safety and other home modifications in more detail in my knee replacement home prep video. It's a complete guide on how to set up your home before knee replacement, and I'll put a link to it in this video's description. Alright, you're out of the shower, and now it's time to get dressed for the day. This is where patients are often caught off guard by how difficult something as simple as putting clothes on can be. When putting pants or shorts on, physical therapists and occupational therapists often recommend starting with the surgical leg. Your surgical leg is stiff, swollen, and harder to maneuver, so it's easier to guide clothing over that leg while it's mostly straight, and then deal with your other leg, which is more flexible. When taking clothes off, the order is switched. Start with the non-surgical leg first, and then you can slide the clothing off the surgical leg without having to bend or twist it. A reacher, sometimes called a grabber, makes this whole process much easier. It's a long-handled device with a grip trigger that lets you guide clothing around your foot and leg, which means you don't have to bend down and reach. You'll also find yourself constantly using it throughout the day for things that have nothing to do with getting dressed. Dropped your phone? Reacher. Grabbing something from a low cabinet? Reacher. Pulling a blanket from the foot of the bed? Reacher. And one more tip, when you're choosing what to wear early on, stick with loose, comfortable clothing like sweatpants or shorts that can slide on easily. Your leg is probably going to feel stiff and swollen, so save the skinny jeans for later. Now that you're dressed and have had a chance to move around, your knee will probably remind you that you just had surgery. So let's talk about how to manage pain and swelling, because having the right equipment here can make a huge difference. Icing your knee is one of the simplest and most effective things that you can do in the first few weeks. Studies show that cryotherapy, which really just means cold therapy, helps improve pain early after surgery and may have some benefits in early range of motion. Different surgeons have different protocols, but a common one is icing for 15 to 20 minutes at a time every 1 to 2 hours. You can keep 2 or 3 packs in the rotation so that at least one is chilling while another is being used. And using a cloth barrier between the ice and your skin helps protect your skin from a cold injury. Now, you may have heard about continuous cryotherapy devices, sometimes called ice machines. These are devices that continuously circulate cold water through a wrap around your knee. Many patients swear by them, and they can certainly be convenient. That being said, they are more expensive, and insurance may not cover them. So if cost is a factor, ice packs can do the job well. The bottom line is, talk with your surgical team about what makes the most sense for your situation. One more quick note on icing. Keeping the leg elevated while icing helps reduce swelling, but try and make sure that the support is under your calf or ankle, not directly under your knee. Most surgeons recommend keeping the knee straight while resting, because keeping the knee bent for long periods of time can make the knee stiff in this position. Speaking of range of motion, you may have heard that a CPU CPM machine can help you regain it faster. Here's what the evidence actually shows. A CPM, or continuous passive motion machine, is a motorized device that slowly bends and straightens your knee while you're lying down. They used to be very commonly prescribed after knee replacement, but multiple large studies have shown that CPM machines provide minimal benefit for most patients after routine total knee replacement. The improvements in knee motion are very small, and they tend not to last. Active physical therapy exercises are much more effective. So for most patients, a CPM machine is not something you need to go out and buy on your own. But some surgeons do still prescribe them for specific situations. So the simple answer is, if your surgeon recommends a CPM for your specific case, follow their guidance. Here's the bottom line. You don't need to go and buy everything on the internet to get ready for your knee replacement recovery. But having the right equipment can make those first few weeks dramatically smoother. Here's a list of all the equipment I talked about that you can pause the video on and reference in the future. I grouped them into what I think are must-have and nice-to-have categories. And keep in mind that the less help you have at home, the more important the nice-to-have items become. I also included a link in the description where you can download this list for yourself. Lastly, talk to your surgeon's clinic before buying everything, because they may have processes in place to help you get what you need. If you're preparing for surgery and you want to know which exercises can help speed up your recovery, I'll put my video on that right here. And if you found this video helpful, consider clicking the like button and subscribing for more knee replacement education. Stay well, and I'll see you in the next video.